Advocacy is the way that we help our at-risk and underserved children that we care for be better cared for, have more resources, and get the care that they deserve.
For me, being a physician is synonymous with being an advocate. I think in order to practice good medicine, you have to advocate for your patients. And I think we advocate for our patients all the time, even if we don't name it that. When we get a prior authorization for a medication that's not covered, when we get a patient who's uninsured or underinsured connected with better insurance. Those are all forms of advocacy.
So on a micro level, it's incredibly important, just patient by patient, family by family. On a macro level, we have the opportunity as pediatricians to talk to our legislators and other elected officials about healthcare policy. And while the micro level of taking care of patients and advocating for them is so important, on the macro level, one decision, one policy, one change can affect, in Idaho, 200,000 children.
A lot of programs have like an advocacy day or a week of advocacy. We have 2 full rotations that are catered around advocacy and community pediatrics. And so we go to the legislature, we talk about different bills, we talk about ways in which healthcare workers, pediatricians can be involved in lawmaking.
So we have 2 different blocks, each block 4 weeks long, so a total of 8 weeks. One block is during the first year of residency, one block is during the second year of residency, that are dedicated advocacy and community pediatrics rotations. So it's really a little bit of a mixture of advocacy, again, at that micro patient level and at the macro policy level, mixed in with learning about community resources, community organizations, partnerships that can be formed to help both individual patients and the community of children, etc.
And they will get the opportunity to take some didactics, some training on things like working with the media, talking to your legislators, testifying in front of a committee on a bill, writing op-eds, things like that. There will also be an opportunity to do a community project. And one of the ideas is that in the first year, the group of residents will decide on an issue that they care about, find a legislator who also cares about that issue, and then hopefully do some background work so that in their second year, they're able to actually put a bill forth that will address that issue and see that bill through the legislative process.
The first year rotation is a little bit more community pediatrics heavy and a little bit more advocacy light, but there's still a good bit of advocacy in there. The reason we do that is we really want our first year residents early on to learn about all the community resources that they can steer their patients and their patients' families towards. As you know, resources for care in their continuity clinic and even at discharge from the hospital. The second year rotation is more advocacy heavy, community pediatrics light, but there's a nice mixture in both of them.
You know, there are a wide range of opportunities. We have an incredible group of faculty who have been doing advocacy work for a long time. The idea behind this program is that we really wanted to give residents training that we wanted to have in our own residency experience. We have faculty who are passionate about trauma-informed care, eliminating or changing or at least addressing racism in healthcare, as well as racism in healthcare education. Folks who are committed to gender diverse rights, reproductive rights, climate change and health, a whole wide range of issues. And whatever a resident comes in interested in, we can provide a mentor in that area.